They cannot stop vomiting. It happens in certain diseases. Anything in the abdomen area or the pelvic area, if there's tumors in the small bowel, if there's any kind of small bowel obstruction that they can't fix because they can't have surgery or because there's a tumor there, there's many, many reasons for it. It really doesn't happen to many people, but it does happen. So when this happens, it's what you think. They continue to keep vomiting, continue to keep feeling nauseous. Now, the worst thing that can happen if this was happening would be to have a small bowel obstruction, like I said, which means you could actually vomit up stool. So again, very rare, but people do vomit up stool. This does not necessarily mean they're end of life. There's a bunch of other reasons why people could be vomiting up stool, but I'm specifically talking about at the end of life. Now, what can we do about it? There are things we can do. So there are a lot of anti-nausea medications we can give. Now, usually these people cannot swallow because every time they swallow, they'll just throw it up. So we usually give the medication rectally or sublingually to absorb in the gums. Those medications can work really well and take care of the problem. As a last result, we can always use an NG tube, which is a nasogastric tube that goes through the nose and down into the stomach. And then we put it to suction to decompress the stomach, and that takes away their nausea and vomiting. We don't like to do this because, one, it's not fun to put that tube in for the patient and then to have the patient keep it in. It's very uncomfortable, but sometimes they still want it because they'd rather have the tube in their nose than have this retractable nausea and vomiting. The last thing, and this thing is rare,